Good afternoon, everyone. My name is Kim Stevenson, Director of Workforce and Clinical Affairs at the Massachusetts Health and Hospital Association. I want to welcome you to today's webinar, Why Having a Chief Wellness Officer is More Important Than Ever. I also want to take a moment now to thank MHA's 2023 sponsors for their support in underwriting today's webinar, which is just one of many events we have to offer throughout the year to connect our members with leading experts to help address timely issues like the one today. I'm pleased to introduce you to our presenter for today's webinar. Dr. Suchetta Doshi is the Chief Wellbeing Officer for the VA Boston Healthcare System. Dr. Doshi is an instructor in medicine at Harvard Medical School, adjunct instructor in medicine at Boston University School of Medicine, and the VA Boston Site Director for the Harvard School of Public Health Occupational and Environmental Medicine Residency Program. In 2021, she represented VA Boston as one of 10 facilities engaged in a national VA pilot on implementing the Stanford model of professional fulfillment among frontline clinical staff and supervisors. Working with both nursing and primary care departments, she was successful in initiating the AMA-endorsed Listen, Sort, Empower practice efficiency tool among various work groups. As Chief Wellbeing Officer, Dr. Doshi continues to work toward transforming organizational culture to mitigate burnout and prioritize wellness-centered leadership, practice efficiency, and professional fulfillment through the only role within the VHA enterprise dedicated to clinician well-being. Thank you all for being here today, and Dr. Doshi, take it away. Thank you.
Thank you, Kim, and it's my honor to be here today with all of you. And thank you, everyone, for taking the time out of your busy work schedule to be here with us today. So today I'm going to be talking about a few models that existed already at the Department of Veteran Affairs and how our local facility here at VA Boston took advantage of those models to really put them towards transforming organizational culture towards professional fulfillment and a culture of well-being. So just to review our local facility, VA Boston Healthcare System, we are the largest consolidated medical center in the VA New England healthcare system, which composes of 8 facilities and several outpatient clinics throughout Connecticut, Maine, Massachusetts, New Hampshire, Vermont, and Rhode Island. Our main campuses are in Brockton, Jamaica Plain, West Roxbury, which is actually the principal tertiary inpatient medical center for VA New England, along with VA outpatient clinics in Lowell, Quincy, Framingham, Plymouth, and Boston. We host 10 national centers of excellence throughout the VHA enterprise, and we partner with multiple academic affiliates throughout Massachusetts and train more than 2,000 future healthcare professionals annually. Overall, VA Boston facilities includes more than 5,000 employees who are caring for more than 60,000 veterans from the greater Boston area and across New England. So just a refresher on clinician burnout and moral injury. Burnout is really an occupational phenomenon. It is work-related, involving emotional exhaustion, depersonalization, and a sense of reduced personal accomplishment. Secondary to these 4 major contributing factors per the American Medical Association Steps Forwards module: lack of control over work conditions, time pressure, chaotic workplaces, and more importantly, when there is a lack of alignment of values, especially around mission, purpose, and compensation between clinicians and their leaders. And when you take burnout in the context of moral injury, which is something that many of our clinicians experienced during the pandemic, that is when you reach that healthcare crisis that we are currently in. When clinicians are distressed in the context of having to cope with the challenge of knowing what care our patients need, but being unable to provide it due to constraints that are beyond our control. And this can result from a disconnect between personal values and that of the organization and the work environment, a devaluing of roles and professional identity, or even when there are microaggressions via conscious or unconscious bias, which can lead to furthering of moral injury and burnout amongst healthcare workers. But I would note that the National Academy of Medicine does note that the absence of burnout or having resilient characteristics does not necessarily indicate well-being. And it's well-being and organizational transformation that will be the focus of this talk today. And why do we care? Because the consequences of burnout can be widespread throughout the healthcare system, including not only organization costs and patient costs, but also the humane costs. And just to note here that physician suicide is still quite a large concern amongst the healthcare environment. Female physician suicide rates exceed the general public by a factor of 4. And the tragedy of Dr. Lorna Breen during the pandemic highlights this, along with the Dr. Lorna Breen Act by Health and Human Services, which is trying to promote healthcare and well-being education throughout the environment. Taking this into context, this laid the background for where the Department of Veteran Affairs decided to incorporate a Chief Wellbeing Officer as one of its initiatives towards organizational transformation. And this is partly because there were multiple events happening at that same time as Dr. Lorna Breen Act. The U.S. Surgeon General Advisory came out on addressing healthcare worker burnout, noting that more than 50% of doctors and nurses were planning on leaving healthcare. The Office of Inspector General at the same time did a deep dive into the Veteran Health Administration's well-being programming, noting that VHA did need to do more to promote emotional well-being supports amidst the COVID-19 pandemic. And at the same time, VHA was also starting to look into how to reduce employee burnout and optimize organizational thriving through the Reboot Task Force. So even though burnout and moral injury existed pre-pandemic, the constellation of events during the pandemic and the immediate post-recovery period is what led the VHA to deliver a statement of issue, where VHA had the opportunity to address the crisis of clinician burnout by adopting industry best practices, and the U.S. Surgeon General Advisory and Reboot Task Force recommended together to implement Chief Clinician Wellbeing Officers throughout the enterprise. So that's great, you say. We want to address burnout. Where do we even start? Where does a Chief Wellbeing Officer start? So Dr. Tate Shanafelt at the Mayo Clinic, who then went on to Stanford, along with his colleagues, published 9 organizational strategies to promote well-being. And these were strategies that were recommended to executive leaders in healthcare as a way to address the concern of burnout and moral injury and bring about organizational well-being. And the first strategy is to acknowledge and assess the problem, determine the drivers of burnout in order to focus on where to harness the power of leadership and develop and implement targeted interventions. And I will review the other 9 executive strategies throughout my talk. So if we get back to the VA journey towards well-being and we consider the Reboot Task Force, the goal was really to build a workplace where every employee could thrive, find purpose, fulfillment, and joy in their work. So every employee could give their best to serving our nation's veterans, their families, caregivers, and survivors. The Reboot Task Force were delineated into organizational and individual focuses, which were broken into 4 streams: recruitment and retention, refining organizational systems and processes, looking at supervisors and managers, and mental health and well-being. As a task force, this was a national VHA enterprise's intentional response to reducing employee burnout, positively impacting employee well-being, and directly supporting the employee engagement framework. And within the Reboot Task Force, the Chief Wellbeing Officer pilot was born. And it was born out of the Office of Patient-Centered Care and Cultural Transformation. This office has designated the whole health system framework since 2014 for the VA to utilize this framework as a way to provide veteran care. And the Chief Wellbeing Officer initiative utilized this framework to take what we were providing towards veterans to our employees. The whole health framework is actually a framework, an approach to healthcare that the National Academies of Science, Engineering, and Medicine recently actually recommended as a model for all other healthcare systems, community programs, social services, and public health organizations. And it's composed of 3 main components: The first component is empower, or the pathway, which is intentional exploration of goals and aspirations to inform a personal health plan. The second is equip, through well-being programs such as health coaching and complementary and integrative health approaches. And the third is treat, via whole person care, where we put the person in the center, and craft an approach towards health and disease management that incorporates shared decision making. Each of these components are applicable to the idea of employee well-being, and that is where the VHA was going next. So what is whole health? It's an approach to healthcare that empowers and equips people to take charge of their health and well-being and live life to the fullest. So it's about changing the conversation, taking it from sick care to health care. So let's change the conversation from burnout to well-being and focus our interventions there. And the concept of whole health really focuses on the 8 domains of self-care, looking at what matters most, what brings you a sense of joy and happiness, and empowering our employees to reach mission, aspiration, and purpose-informed goals. What are your strengths, accomplishments, sources of pride? And it incorporates these into an approach to prevent and treat. So every employee can ask themselves, my well-being is critical to my effectiveness as a healthcare worker, as a patient, as a parent, as a spouse, as a child, or as a member of my healthcare community. Connection is key and community is what matters. And whole health is the approach to help all our clinicians achieve well-being within the community that they belong in. At the same time that VHA was really launching whole health and bringing it from our patients to our employees, VHA was also starting a journey towards a high reliability organization in 2019. And the foundation of a high reliability organization is that it is a complex organization where there are high hazard domains, and yet an organization that's an HRO, or a high reliability organization, can still manage to survive for extended periods without serious accidents or catastrophic failures. And it's dependent on systems thinking. It's dependent on trust between leaders and their staff to accomplish a just culture. It's a framework that is in process, that has been in place for the transportation and aviation industry for many years. And the Agency for Healthcare Research and Quality recommended this for healthcare, which is, again, another complex organization, in 2008. An HRO foundational practice is dependent on 3 pillars: leadership commitment, a culture of safety, and continuous process improvement, with 5 principles where everyone is sensitive to operations, deferring to expertise, and there's a reluctance to simplify. We ask why to make sure that we get to the root cause. And within this framework, there's leadership rounding, where leaders will talk to their frontline staff to determine what they are seeing as issues in their workplace. We have regular daily safety huddles. We have a visual management system where we recognize our frontline staff who bring good catches forward. And we have regular daily safety forums so that we are aware of every event as it's happening. So it's within this context of both looking at whole health as an approach to well-being and being on a high reliability organization journey where we are increasing trust between our leaders and our frontline staff, that VHA saw an opportunity to implement a Chief Wellbeing Officer role. And the thought process behind this was very simple. When VHA clinicians are burned out, it affects everyone: clinical staff, other employees, and the veterans who depend on them for their healthcare needs. So that's where we implemented the Chief Wellbeing Officer program to incorporate a role of a leader, a strategist, and a clinician advocate for well-being at the facility level that is focused on transforming organizational culture to mitigate burnout and prioritize professional fulfillment. It is the only role within the VHA that is dedicated to clinician well-being. And at the same time, this role collaborates with the employee whole health coordinator, who is implementing the whole health model of care, our employee experience officer, who is committed to engagement of all employees, our high reliability organization officer, who is implementing the HRO model, and our Chief Diversity Officer, who is looking to make sure that we are incorporating a diverse, equitable, and inclusive workspace. So the CWO interacts with all of these officers to transform not only organizational culture for clinicians, but in effect for all employees. And the framework that was utilized during the pilot year, which was 2021 and 2022, and put into place into 10 medical centers, including Boston, was a Stanford model of professional fulfillment. And this model, while it initially was set into place at Stanford for physicians, is applicable to any clinical environment. And it accounts for the fact that individual culture is not just the only culture that contributes towards well-being. We have to look at systems. We have to look at the institutional drivers, including supervisor and leadership culture and a culture of well-being, and our immediate practice environment, and looking at the drivers of burnout within the practice, within the work culture that lead to autonomy that are contributing towards professional fulfillment. And I have this quote by Muhammad Ali here because at the end of the day, it isn't the mountains ahead to climb that wear us out, it's the pebbles in our shoe. So looking at practice efficiency is a way to look at those pebbles that are the drivers of burnout and starting to address it as a team. We implemented our pilot in 2 teams within inpatient nursing unit and the primary care physician and advanced practice professional group. At the same time that we were implementing the Stanford model of professional fulfillment within our 2 pilot teams, we also received a grant at VA Boston to spread whole health within work culture, within the work culture of specific teams as well. And the Employee Whole Health Ambassador Grant focused on developing whole health employee well-being champions within work units. We implemented this grant by weekly education series, a community of practice support, and individualized coaching to support projects. The service level champions were actually leveraged to take part in the Stanford model of professional fulfillment grant from the Chief Wellbeing Officer perspective. And so we had nursing and primary care collaboration there where we leveraged our service level champions to implement Listen, Sort, Empower, which is a tool that I'm about to speak about. Our ambassadors supplemented existing self-care resources, including our fitness centers that exist throughout our 3 main campuses, where we have the first VA spin cycle room in the nation, outdoor fitness centers, motivational stairwells, walking workstations, relaxation rooms, staff wellness classes, and became instructors for our Caring for Yourself self-care workshop, which is now spreading nationally throughout the VA. These are some of the examples of ambassador projects within work units. And as you can see, all of them fall within the Stanford framework. We had an ergonomic education happening for our gastroenterology service within the context of practice efficiency. We had peer coaching happening within the context of culture of well-being. And we had everyday regular well-being activities within the context of an individual self-care and resilience activity. Listen, Sort, Empower was part of our Stanford model implementation from our Chief Wellbeing Officer implementation. And this was a strategy to promote professional fulfillment, specifically by identifying drivers of burnout and fostering healthy clinician leadership relationships, supporting teamwork and camaraderie, and overall improving team dynamics, processes, and systems of care. And I have this cartoon here to really exemplify what Listen, Sort, Empower's goal is. At the end of the day, it's to bring our leaders and our frontline staff closer to indicate that there is always going to be this element of support within a stressful work environment. The strategy actually came out from Mayo Clinic, and Dr. Steven Svensson has created a module for this on the AMA Steps Forward website. And it's composed of 3 basic steps. One is listen, which is done in a psychologically safe environment without supervisors and facilitated by a neutral member of the team that has the trust of the entire team. It's structured in a way to identify what makes a good day, what processes work well, and what are the pebbles? What are the daily frustrations in your shoe that you would like to be streamlined or eliminated? The next step is sort, where the supervisor comes back in and assists the frontline staff to go through those pebbles that were identified and listen and sort them in the area of high impact, high feasibility, that are low hanging fruit, that are within the team's control to address right away. Whatever may be under a shared control with maybe another department or another service can be addressed next. And then those pebbles that are not in the team's control and not in under local control and may need to be escalated up to leadership can be brought forth through the tiered huddling system of the HRO up to the facility huddle and beyond. And then the third step is to empower and to support members of the work group, members of the immediate team, to work on these pebbles themselves so that the solution to their daily frustrations comes from within. And rather than something that's handed to them, it is a solution that they, as the team themselves that is impacted, were able to work on themselves, bringing back a sense of autonomy. Mayo Clinic did this with 217 clinical units, over 11,000 staff. And what they found was that satisfaction went up by 17 points, but more than that, burnout went down by 21 points, which makes it a very simple solution to really start looking at drivers of burnout within a clinical work group and address well-being. These are some of the quotes from our frontline PCPs and frontline nurses after we implemented this in those 2 units. I appreciate your efforts and the work that you have put into this. It makes us feel that you care about your team members. We can do this together. I hope things are going to improve. Just being in these sessions helped improve our communication with each other. After sorting with supervisors, the atmosphere at work has become so much better. So even though they didn't address the pebbles completely, just the process of going through listen, sort, empower brought the team together and spread a sensation of well-being throughout the team to work towards culture change. Now, this slide shows the drivers of burnout that were identified by the pilot team members alongside the drivers of burnout identified by Reboot. And what you can see is that workload tops both lists. Unmanageable workload was the number one thing identified by clinical staff as contributing to burnout. In addition, lack of job control or lack of autonomy, low recognition, organizational support, and an absence of peer support or career development or mismatched values. So the commonality here is that whether it was an inpatient team, an outpatient team, or any employee throughout the VHA, there are very common drivers of burnout that could be addressed as an organization. And that is where the VHA Reboot Task Force came up with its priorities. Beyond implementing a Chief Wellbeing Officer role, beyond the 10 pilot sites to 1 in each regional network with it throughout the entire country, and hopefully into each facility within the VHA enterprise. The VA also enlisted these other 6 priorities, including optimizing meeting practices. Who doesn't want shorter meetings? Optimizing TMS education and training so we could eliminate training that added no value and hone in on delivering education in a way that actually was effective for our clinical staff. Strengthening mental health support for our employees. Addressing inefficiencies, removing those pebbles that add absolutely no value to our daily work life. Maximizing use of HR so we could recruit and retain quality staff, and strengthening culture of servant leadership so that we continue towards that just culture of the high reliability organization. So let's get back to the Stanford model of professional fulfillment. How do we implement those recommendations? And that's, again, looking at an organizational culture. If we hold our leadership commitment and accountable to daily changes in our work environment through daily huddles, leader rounding, and safety forums throughout an HRO, that is where we can get to many of these drivers of burnout and start to address them through an infrastructure and resources to support wellness, through regular measurement of well-being and professional fulfillment. The VA has an all-employee survey that is reviewed yearly by leaders, and action plans are developed to really try to address what our frontline staff are asking for. Recognizing and appreciating our frontline staff through Good Catch Awards or other awards. Making sure that we are fair and inclusive, that diversity, equity, inclusion is part of our mission. We also have violence and prevention committee at our facility. And we have an employee assistance program. These are different ways that an organization can support a culture of well-being. Our whole health practices support individual culture of self-care and self-compassion. And by distributing listen, sort, empower through clinical teams, we can start to really support a teamwork model of practice and redesigning our workspace, making sure that everyone works at the top of their license, that there's mentorship and coaching, that we streamline those pebbles that frustrate us every day, and also think about work tour flexibility. So in getting back to measuring well-being and how that reflects on organizational health, these questions were added to our 2023 VA All-Employee Survey. And these will be tracked over time as we start to implement reboot priorities to see if the baseline changes and improves, very similar to what Mayo Clinic did in their worksite. And what we are starting to focus on is bringing back the healthcare worker well-being hierarchy. Because if our basic needs aren't met, if our clinicians aren't hydrated, if they don't have access to food, if they haven't had time to eat because they're seeing patient after patient after patient, that does not give them the time to heal patient and contribute. So this hierarchy looks at where an organization should start first. Start at the basics. Ensure that your clinicians and your patients have a safe environment, that people feel their job is secure, that there is a basic level of mutual respect and inclusion, that our clinicians aren't hassled by IT or bureaucracy, and that we recognize and we appreciate our staff. And it's only then that our clinicians can have time, autonomy, and resources to heal patients. And that gets us to how to move towards wellness-centered leadership. So on the left side of this slide is Stanford's model of a wellness-centered leadership. And on the right side is the VHA Whole Health Empowering Your Teams model of how to move from transactional leadership to transformational leadership. And essentially, we already embrace servant leadership at the VA as our goal in putting the needs of our customers first. But sometimes with this style, our leaders do take a back seat to the needs and goals of their employees. Transformational leadership looks at each individual member of a team alongside the team itself, supporting positive transformations from within. In transformational or wellness-centered leadership, we care for people always, all employees at every level, and cultivate relationships where we inspire and motivate employees to innovate and create change to shape cultural transformation. It's through this shared culture, ownership, and vision where everyone's values align with the mission that they are less likely to feel depleted, even if their job does involve stressful or less fulfilling activities. And a final note on what Mayo Clinic did was trying to get towards work-work balance. They found that physicians who spend 20% of their effort focused on the activities that they find most meaningful are significantly at lower risk of burnout and more likely to create change. So ask your employees what matters most, coming back to that whole health concept of what matters most. What drives their personal calling in the healthcare arena? It's through that lens that we can align employee values with organizational mission and inspire change. Servant leadership and transformational leadership work in collaboration for an organizational-wide strategy towards a culture of well-being and clinician professional fulfillment. And that is what the VHA journey is all about, creating a culture of well-being towards zero harm, where we can take the principles of a high reliability organization, combine it with the model of whole health, and focus on processes, correct workload imbalances, follow an iterative approach, and promote work-life integration through employee whole health approaches. So finally, I will say that at the VA, we can ask, what's in it for me? And we're hoping that through combining a high reliability organization with a whole health model underneath the movement of Chief Wellbeing Officers at every single facility, our supervisors and leaders can have an engaged workforce with improved professional fulfillment. Processes are improved, we eliminate those that add no value, and we innovate change, and we build on trust and relationship building. For our employees, they'll feel a culture of empowerment and psychological safety, which will bring about joy in work and support for whole health and well-being, and a sense of purpose where their values are aligned with the mission of the VA. And overall, that will lead to our veterans feeling more empowered and equipped in whole health and self-care, higher satisfaction with care and experience, where they will choose the VA. So, thank you, everyone, for your attention today. And I really appreciated speaking to all of you today about the VA's journey towards a culture of well-being.
Thank you so much, Dr. Doshi. We really appreciate your presentation today, and I know that there was a lot in that presentation that our attendees will be taking back to their organizations. As we are coming up in time, I just want to mention that we're happy to host this Caring for the Caregiver webinar series, and this recording will be posted along with all of the others in the series on our Patient Care Link website. Thank you all for joining us, and you can scan the QR code on your screen now to see all of MHA's educational programming. We have a number of events this fall, and we hope to see you again soon. Have a wonderful afternoon. Thank you.